Assalamualaikum warahmatullahi wabarakatuh. We are Group 1 from AS1205E will present our case study about breast cancer. I am Tuan Nur Hidayah binti Tuan Johari and my group member is Nur Umi Balkis, Nur Nashwa Melda and Nur Akila. What is cancer? Cancer is one of the most chronic diseases that found in the medical world. This is caused by the action of the cell that's outside of their normal routine. This cell usually divide at the controller rate and produce according the needs of individual body. But when the rate of cell production product more extra tissue, that tissue will call as tumor. This is the start of the cell cancer will produce in our body. Why is cancer called as chronic disease in the world? Because cell cancer can destroy some of our specific organs such as brain, bone, skin and more of our organ. Lately,
What is main causes of breast cancer? Main causes of breast cancer develops when some breast cells begin to grow abnormally. The cells divide faster than healthy cells and continue to clump together to form a lump or mass. Cells in the breast can spread or metastasize to lymph nodes or other parts of the body. Breast cancer is mostly caused by cells in the milk-producing ducts, or we call it as invasive ductal carcinoma. Breast cancer can also start in the glandular tissue known as lobules, invasive lobular carcinoma, or in other cells or tissues within the breast. Breast cancer spreads, it typically goes first to a nearby lymph nodes under the arm. It can also sometimes spread to lymph nodes near the collarbone or near the breastbone, which is the front center of the chest. Cancer cells may travel in the bloodstream or through the lymphatic system. Cancer that travels via the lymphatic system may end up growing inside the lymph nodes. Axillary lymph nodes are in the armpits, which are close to the breast. Since the axillary lymph nodes are so close, breast cancer usually spreads to them before other lymph nodes. Breast cancer develops because of genetic mutation or DNA damage. This can be linked to estrogen exposure, inherited genetic defects, or inherited cancer-causing genes such as the BRCA1 and BRCA2 genes. BRCA1 and BRCA2 are tumor suppressor genes that, when working properly, both prevent breast cells from growing abnormally. However, when these genes are mutated and no longer function properly, the risk of breast cancer increases. The genes involved can influence hormone levels, metabolism, and other risk factors for breast cancer.
Next, we will move to the factors that increase the risk of breast cancer. The first factor is daily exercise and diet. Physical activity should be done on a daily basis to get the health benefits. Even if you don't do much right now, it may be easier than you think to boost our activity. Eating a healthy and balanced diet can help you to keep a healthy body weight. There is evidence that being overweight or obese after the menopause can increase the risk of breast cancer. Having one or more breast cancer risk factor doesn't mean that you are having a breast cancer. Inherited genes are among the factors that cannot be changed, which link to the increased risk of breast cancer. Certain breast cancer related gene mutation can be handed on from parents to children. BRC1 and BRC2 are the most well-known mutation genes. These genes can significantly increase the chance of having breast cancer and other malignancies, but that doesn't mean that you having breast cancer. The third one The third factor is dense breast density. Dense breast tissue can increase the risk of breast cancer and make lumps more difficult to detect. Breast density is a proportional measurement of a woman's breast granular, connective, and fatty tissues. Mammography, which is a diagnostic technique that uses low-dose X-rays, is the most usually used to determine the breast density. Dense breasts are not an uncommon condition. In fact, roughly half of all women over the age of 40 have a dense breast. Aside from inherited genes, one of the most important risk factors for breast cancer is aging, because the incidence of breast cancer increases with age. As a result, women over the age of 40 should have a mammogram screening done ahead of time. Early menarche, late menopause, late age at first pregnancy, and low fertility can all raise the risk of breast cancer. For additional information, each year that menopause is delayed increases the risk of breast cancer by 3%. The next one is other than a high dietary fat intake, excessive alcohol consumption, for example, can raise the risk of having a breast cancer. Alcohol drinking can raise estrogen-related hormone levels in the blood and activate estrogen receptor pathways. Alcohol is broken down into a toxic chemical and can also interfere with our body's chemical signals, which is increasing the likelihood of cancer developing. The last factor that increases the risk of breast cancer is postmenopausal hormone therapy. When used for more than 5 years, several kinds of hormone replacement treatment throughout the menopause and certain oral contraceptives or birth control tablets have also been linked to an increase of risk of breast cancer. Drug exposure such as diethylstilbestrol or DES were used by pregnant moms to avoid miscarriage, early labor, and other pregnancy problems. When women quit taking this medication and adjust their lifestyle, their chance of getting breast cancer will reduce.
Hi, I'm Nashwa. In my part, I'm gonna share about the most popular treatments in case of the breast cancer. We go to the first treatment, which is cancer surgery. There are some surgery to treat the breast cancer. First, a lumpectomy, removing of breast cancer. Second, mastectomy, taking off the whole breast. Next, sentinel node biopsy, which is only a few lymph nodes are removed. And then axillary lymph node dissection, where several lymph nodes are removed. Next treatment is radiation therapy, or commonly known as radiotherapy, which functions to destroy cancer cells and reduce tumor size. Although the radiation treatment is harmless, eventually it may result in skin discomfort on the patient's body. The third treatment is the most famous treatment in any cancer type, including breast cancer, which is chemotherapy. Breast cancer patients often receive chemotherapy as a systemic therapy. In this systemic therapy, drugs or medication combination are distributed throughout the patient's body. The last treatment is hormonal therapy. Hormonal treatment is effective for treating breast cancer that expresses the estrogen receptor, and PR, progesterone receptor, in both early stage and metastatic form. By blocking the hormones, it can help in preventing a cancer recurrence and mortality from breast cancer when this therapy used for early stage disease. Before we go to any treatment, we can do some prevention and control our lifestyle. Some prevention and some controls that we can do before we went to any treatment. One of them is limit and control drinking alcohol. This is because the chance of developing breast cancer increase with the amount of alcohol you consume. According to some research, the general advice is to keep intake to 1 drink per day or less, because even a little amount of alcohol raises a risk. Next, we go to be sure to keep a healthy weight. As a doctor for any advice on healthy weight loss method, you need to shed some pounds. Daily calorie intake should be decreased and should gradually increase the amount of exercise. Next, be active. Be active physically. Exercise is the closest thing to a magic cure for excellent health. That there is. A woman's risk of developing breast cancer is reduced if she exercises for at least 30 minutes each day. Then we go to the breastfeed. For your information, breastfeeding may function in the prevention of breast cancer. The protective effect increases with the duration of breastfeeding. Then, never smoke, because smoking can at least be the cause of any cancer, including breast cancer. On top of it, numerous other negative health effects. And the last one is avoid menopause hormone therapy. According to studies, menopause hormone therapy has mixed impact on health, increasing some disease risks while lowering others. Hormones elevate the risk of breast cancer regardless of whether estrogen is consumed alone or in combination with progestin. The lowest amount of time should be used if women do use hormone therapy during menopause.
We should not take this disease easy anymore, because this disease can lead to our death. All of us can develop a cancer cell in our body if we not take care of our healthy properly. So you need to care of yourself to avoid you develop your own cell cancer. Okay. After know how the cell cancer pull in our body, we should be able to reduce the risk of getting cancer in our future. Avoid cancer is not for others but for ourselves. So if you love yourself, take a good care of yourself. That's all from us. Thank you. Bye bye.